So, what is a collapsed lung, and how could someone get a collapsed lung from a physical therapy technique called dry needling? A collapsed lung or a pneumothorax is when air somehow gets into that space, it disrupts the vacuum, and the spongy lungs can partially or completely deflate. Okay, that's a pneumothorax. Now, that can happen from broken ribs, bad injuries, any kind of penetrating wound. It is a known, but thankfully extremely rare potential complication to come from something called dry needling. Dry needling is a very common physical therapy technique that is used to calm down muscle spasm and tightness, things called triggers. Okay. So if we have a tight area in a muscle, we can actually go in with a very small needle. It's small, so small you can't even see it. It's very similar to an acupuncture needle. But if somebody has a trigger, this teeny needle can go in and cause the muscle to spasm or twitch and then relax. And that can help us to improve pain, restore function, get people moving and feeling better. You can imagine, while this is something we use in people every day, high-level athletes really beating their bodies up, these type of modalities are used day in, day out, trying to keep these people in the game. Okay, now we use the term dry needling because this is a solid needle. There's no medicine being injected. The needle is just going in for the purpose of causing this muscle to twitch. And dry needling is a little bit different than acupuncture. The needle is very similar, but dry needling is going into an actual physiologic spot where there's a muscle issue, whereas acupuncture is based on ancient Chinese medicine meridians or maps where needles are put into certain locations based on the desired goals of treatment, calming stress, improving wellness, improving pain, inflammation, etc. Now, if we look at what has happened to TJ Watt, they had to make a small incision and actually put a little tube in between the ribs to reinflate the lungs. Now, that tube gets removed, and as long as no air gets back in there, that really is the end of it. Unfortunately, there's a little bit of time for this all to seal up and heal, so it's not looking good for Monday night. We do know dry needling can potentially cause a pneumothorax. Thankfully, in our practice, in my 17 years, I've never ever had or seen anybody develop that. I think it is in good hands a wonderful, very powerful technique to get people feeling better. I've had it countless times. I certainly wouldn't shy away from having it, even in my thoracic, my rib cage, even in my shoulder, the areas around my lungs. As long as I know the person who's doing it to me is doing a great job, I know there's a great chance it's going to help me and an extremely low risk of problems.